Hello, this is Bob Browner. I'm recording an example of how I think we could do a better job with our Medicaid managed care in Nebraska, and I'm recording this from two perspectives. One is a concerned taxpayer who's concerned about the millions of dollars we're spending on Medicaid, and is it being spent appropriately. Second, as a physician who spent his entire career working to improve health systems in Nebraska. We have many examples of how this is being done across the country and in Nebraska, and I think it's time that Medicaid came to the table in the same way the rest of us are doing this. We're spending a lot of money on Medicaid, $850 million just from the Medicaid line item alone from our Nebraska taxpayers. On top of that, of course, some of our dollars are matched federally, so we're spending over $2 billion a year on Medicaid. Is this money being spent the way it should be spent? I'd like to propose an example of how this is being measured for other insurance payers in Nebraska. So Medicare has contracts with 8 Nebraska-based ACOs right now. I've actually was part of starting 2 of these. What you see here is ways that you could really manage and measure to see whether this money is spent correctly. So for Medicare, they see how much is being spent for each patient on average for each of these health systems when they care for the patients. They see how many patients are admitted for every 1,000 patients. They judge each of these on customer satisfaction. How would I rate my doctor on a scale of 1 to 10? Did they get me to the right specialist? Did they give me timely access to care? On top of that, they add clinical measures. So, for example, are patients getting vaccinated like they're supposed to? Are they getting breast and colon cancer screenings like they're supposed to? If they have diabetes or high blood pressure, is it under control? And so annually, these measures are made public so anybody in the country can verify that if I go to this system or this system, what kind of care am I getting? Am I getting the diabetes care I should get? Am I getting the vaccinations? And how do I compare when I'm taken care of by these 8 health systems? Medicaid managed care should be doing the same thing. Have made contracts with 3 managed care providers. Each is being paid hundreds of millions of dollars a year. Are they using that money wisely, and how are each of them doing compared to each other? Without metrics like this, you really can't tell for sure. This is not unique to Medicare. Blue Cross Blue Shield of Nebraska has been doing this for more than 4 years, and all 8 of these have, to my knowledge, have contracts with Blue Cross Blue Shield as well. I've been told that Blue Cross Blue Shield will be making its most recent year's numbers public in the next week or so. I'm not sure if they'll actually release this degree of transparency that Medicare has, but again, other insurers are doing this. And when I previously worked with 2 Medicaid managed care companies, one was Serpa, Aetna, and Arbor, both of those were moving toward this before Heritage Health came along. So this is doable in any health system environment, including Medicaid, and should be. As an example, I actually work with quality improvement on a lot of safety net clinics across the state. These are clinics from Omaha and Lincoln and as far west as Gering. The difference between these clinics are all take care of low-income, Medicaid, refugee-type populations. The difference between these clinics is not quality of care. You may think that these clinics are doing worse in terms of cancer screening for some reason, for their lack of screening. But the main reason patients are not being screened in these clinics is because they just don't have any Medicaid coverage. This clinic here has very few uninsured. Each of these clinics, as you go down the line, has more and more patients who lack health insurance, and because they lack health insurance, they can't afford colonoscopy. And so that's lack of coverage is what's determining the lower cancer screening rates in these patients. If all these patients were screened at the same rates as this clinic because they had the same health care coverage, that would be 4,000 more Nebraskans who were screened, and that'd be 4 to 8 people who will not die from colon cancer if they receive that proper screening. This isn't unique to the safety net clinics. This is actually a statewide problem. So this is maps produced by Ted Frazier from Great Plains Quality Improvement. He has access to the entire Medicare claims data set for the state. He's been producing these maps for more than 2 years now, and essentially you can see that the variation in cancer screening rates across the state. It bothers me personally because I'm a Sidney, Nebraska native, grew up here in Cheyenne County, and it pains me to see that they have the worst cancer screening rates in the state. Part of this is due to coverage, and this isn't just 4 to 8 Nebraskans. This is when you extrapolate that off the top entire population, it's probably at least 50 to 100 Nebraskans per year dying of just colon cancer alone because of lack of screening from lower coverage out west versus here in the eastern part of the state. The same thing is true for breast cancer screening, cervical cancer screening, control of diabetes. You could produce similar measures, and this should be done with Medicaid data. We should have something like this, and so for you to provide proper oversight to Medicaid managed care and to make sure state dollars are spent wisely, we need to create some type of a system like this. The Medicaid managed care companies should be providing this to you, and in turn the Medicaid managed care companies should also be judging us exactly like Medicare and Blue Cross Blue Shield are doing. This isn't new, and it's being done across the country. I'd also refer to this blog post written by Chris Kohler, who's one of the nation's leading experts on this. He basically wrote a Dear Governor letter pointing out that there are a lot of states doing good work in this area, especially in their Medicaid programs. He lists several examples, and I'd be happy to talk with any of you about them. I've testified numerous times about some of the things that Arkansas is doing. If I were to pick one state, I'd actually pick Oregon's way of doing things. And the reason Oregon specifically is Oregon started doing its Medicaid reform before the Affordable Care Act or Obamacare came about. They actually accomplished this in a divided state Senate where they had 30 Republicans and 30 Democrats. They got their bill passed 58 to 2 because it was a well-written bill. One of the architects of the bill actually gave a lecture at the UNMC College of Public Health a few months ago, and his name's Bruce Goldberg. I asked him if we passed our Medicaid expansion bill, would he come back to talk to us, and he agreed to come back. So I'd be happy to bring him back. One reason that they chose that approach in Oregon is just like us, they're a pretty diverse state. They've got quite left-leaning Portland, of course, but eastern Oregon is every bit as rural and libertarian and conservative as our western part of the state. They decided to regionalize their Medicaid system to reflect the needs of the various regions of their state, and it's working out really well. More than 5 years into it, they're actually saving money compared to projections while increasing the quality of care provided to Oregonians. We need something like this for Nebraska. So Chris Kohler, we've also had him come speak in the state before. He actually has a Nebraska Ritz. His parents met at Creighton, and if I remember correctly, his mother grew up in South Omaha. Be happy to try to help you bring them in as we make our plans to expand Medicaid. I think we need some oversight and accountability. It's very hard to manage what you don't measure, and we need better measurement for the state. So thank you, and I hope this provides some ideas. I'd be happy to meet with any of you in the future.